My parent face support, I am Dr. Momo Shochudri, MSCOO7 Bash. Dr. Momo Shochudri, Bangladesh Medical and Dental Council registration 75,995. MBBS, Bachelor of Medicine, Bachelor of Surgery. I am the representative of Dr. Momo Shochudri, MSCOO7 Bash. Sohel, Dr. Sohel. Those are believe me a doctor. Cordially, not corruption, non greedy, not by force. How much patient? Different. 10 lakh. Okay, fine. For medical physics, medical chemistry, I salute my twinkle twinkle little star. Ya Alif Lam Lama. Allah Shafi, Allah Mafi, Allah Kafi. This is correct. Then royalty. You know that vital sign come in by patient by doctors. Doctors see that. See the patient. The vital signs come in normal. And what is the diagnosis? And treat the cause, and patient come good, ill looking to good looking, and vital signs come in normal. For example, pulse 70 beat for adult patient, pulse 70 equal more or less 70 beat per minute, and heart rate, pulse, respiration equal more or less 16 breath per minute, and pain remove, and fever remove, and fever remove, pain remove, and sign of inflammation remove, rubor color, dolor, delor, rubor redness, color, raise of temperature, dolor, loss of function, rubor color, dolor, rubor color, dolor, rubor color, tumor, swelling, dolor, loss of function in that cell, cellular corporate, in case of cell, organ. Correct? Now then see that vital sign with document evidence. And if cure with document evidence, I should have royalty, then those hospital give right, they should have royalty, then doctor chain of command, professor, associate professor, assistant professor, residency, register, resident medical officer, then honorarium medical officer, intern doctor. See that. Then in case of male patient, brother, in case of female patient, sister, and chain of command, and also pathologist or microbiologist for document evidence, correct or not, and routine examination. For example, routine exam. What is routine examination? Already diagnosis that routine examination that disease. Routine examination like CBC, complete blood count with ESR, then RBS, random blood sugar, then ECG, coming normal, then serum creatinine, then chest X-ray. In routine examination coming normal with document evidence. Then who is patient of who is disease diagnosis by document evidence, by test examination. If I correct that, again test that, is it correct? Document evidence. If see the vital sign, then correct or not, then with document evidence, correct. Then patient say I feel better and I am well now. You should have chance to go to home. That is the document evidence. We are give that treatment. You are well now. Feel better. Thank you very much. Now my friend will support medical physics. For medical physics, yeah, for medical chemistry, medical physics. In case of my, I'm Dr. Mohammad Shoaib Choudhury, MSCOO7 Sohel. In my Google royalty $10 per minute, YouTube $9, Facebook $8, Instagram $7, TikTok $6 per minute. Lecture. Then you know that in case of my patient, for medical physics 10 lakh, for medical chemistry 1 crore royalty. And normal patient, in case of drug by drug, that is 1 lakh royalty. My A to Z version. Thank you very much. Now my friend supporter, medical physics, medical chemistry, in terms of lab physics, lab chemistry. For lab physics 1 crore royalty, lab chemistry 10 lakh royalty. For lab physics, lab chemistry, you feel that ya Quddus yallo Abdul Quddus, ya Wadud yallo Abdul Wadud. Now you see that come in lab or not come. What is the labology? Do labology, not sexology. Believe one and only creator and do labology, not sexology. If you do sexology, you feel pain. If you do labology, you feel better. Dr. Mohammad Shoaib Choudhury, MSCOO7 version. Now my fan base supporter all over the world, think good, say good, do good. About one and only creator, ALLAHU and creation. In case of my lecture, science class, science lecture. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, database, mathematics, calculation, with movement, with experiment. That is science. About one and only creator, ALLAHU, also creation. Somebody say one and only creator name, other name, God, Ishwar, Bhagwan, Khuda, Mahbudillah. As a Muslim, I say Allah. Allah is the one and only creator except Allah, all creation, last and best prophet. Honesty is the best policy. By worksheet, not word. How are you are honest human? How can you understand? If you believe one and only creator, then how much you DNA clear? Equal above 1000 or no? And contain, maintain, obtain that. By DNA clear. Now, how much knowledge you gain in science field? By quality, quantity, qualification, you are idiot, stupid, master of science, scientist, dead, granddad, dead to the power square, granddad, cube, dead to the cube, dead to the 4, dead to the power 5, for 4, dead to the power 10 for love. And you, if you are by quality, quantity, qualification, come in scientist, believe one and only creator. If you accept Islam, Al-Quran, Allah is constant truth, Al-Quran is truth. I accept Islam religion cordially, not corruption, not greedy, not bad. You are Abdullah. Who know Abdullah? The English meaning of Abdullah? No, you are Abdul Ali. First Abdullah, servant of Allah, creation of Allah. Allah is the one and only. Last and best match, no. Then you are scientist. Then Abdul Ali. You know that? That is the point. Those are Muslim pathway. Muslim scientists pathway. You have the monas. And in your genome, take the Arabic language. Last and best holy book come in Arabic language. If say Anar Abdullah, your genome take that. Then Anar, if you scientist, Muslim scientist, you say Anar Abdul Ali. I am servant of constant, no fool, constant science fool, one and only creator, Allah. Your genome language Arabic. What is genome? You cell contain chromosome. As per medical science, 44 autosome, 1 sex chromosome, X and Y. In chromosome there is a genome. In genome there is a DNA. Your hair follicle also contain DNA. You check your DNA, how much clear? equal or more 1000 or not. If not, then correct. Otherwise, your creation will be addictive. What you eat, drink, not feel better. If you decrease 900, someone 100, 100 reduce, that is the reason you cell ATP utilization also reduce. And your happiness also reduce. How much? You know that you eat, that is in case of human, liver, in case of fat and carbohydrate breakdown in GI tract and go to the blood, go to the liver, gluconeogenesis produce glucose and storage as a glycogen. Protein, fat, gluconeogenesis, glucose, carbohydrate, sucrose, fructose, lactose break down to glucose and produce to liver glucose, and glucose go to the blood and blood to A to Z cell, A to Z organ, then organ cell fuel, you know that glucose and oxygen in your cell fuel. Where occur? ATP, powerhouse of cell, mitochondria, powerhouse of the cell. In powerhouse of cell, ATP and glucose and oxygen produce ATP, adenosine type process, cellular function. If anyone glucose reduce, that is hypoglycemia. Normal blood glucose what? Random blood glucose equal more or less 7.8 millimole per liter. What's the medical science? If take glucose, your glucose come in 11.1 glucose tolerance test, GTT, glucose tolerance test, GGT, glucose tolerance test. You are diabetic or not? Take how much amount of glucose? If come in 11.1 for 3 consecutive tests, then you are a diabetic patient. Okay, fine. Also random glucose 7.8 more than equal 7.8 millimole per liter. Also fasting blood glucose. What is fasting blood glucose? 6 equal more or less 6 millimole per liter. 6.1 or 6 equal more or less 6 millimole per liter. If 3 consecutive tests raise more, then you are diabetic patient. Control your diabetes by your diet. What is your BMI scale? And your BMI scale is come in BMI scale and take in that amount of food can glucose remain normal level. That an amount of carbohydrate, protein, fat you take every day. Then without drug, without insulin, you can survive. In that how much your pancreas cell, how much you, otherwise you take drug, diabetic drug, reduce, then insulin resistance, then go to the exercise, balance diet control, exercise, then diabetic drug, then insulin to correct. If you take every day by insulin habituate, what happen? Once upon what happen? Insulin resistance develop, then your pancreas cell not producer the 80% or 90%, what happen? Not work. If 80% or 90%, 80% or more than 90% cell of pancreas go to the reversible cellular injury or irreversible cell injury, then pancreas transplantation and correct. If pancreas transplantation occur, then what happen? Also, those donor pancreas maintain 100% cell or 90% cell correct, normal cellular size and shape. Then pancreas artificial mutation and what else? Patient pancreas cut down and and transplant the pancreas. After transplant pancreas, not graft HLA, what say HLA? Graft rejection, host graft rejection not occur. Pre-operative, per-operative, post-operative management. Then, then you see the blood now come in normal position. That's been plantation success. And now you not need to take glucose. What is check the glucose level? Fasting blood glucose, random blood glucose, glucose tolerance test, remain normal. Now you are not need take glucose. Those patient are go to the by exercise. Those patient pancreas 90% cell not work for them. Thank you very much, my friend supporter. Today's enough from science class. Every human have pancreas and glucose level. By that glucose level, if not eat, go to the hypoglycemic. If take more, hyperglycemic. By that organ pancreas, and every cell need fuel ATP, glucose plus oxygen ATP. All human are creation. Creator no need fuel for survive. Creation need to fuel survive. By that logic document database mathematics, all are human. Proof. Except all are human in our earth. If human are all are human, all human are creation proof. If human is creation, then other organ, other animal, they are creator, they are also creation. Tree, they are also creation. And other animal have brain like human. Understand pancreas glucose? That is no. And prokaryotic cell like virus vector, also creation. In case of every human infection occur, and sign of infection: rubor, color, dolor, tumor, rubor, redness, color, raise of temperature, dolor, loss of function, tumor, swelling, also traumatic injury. By that medical science, you know that one and only creator is one and only. As a Muslim, I say Allah. Allah is the one and only creator except Allah, all are creation. You know that by that one and only creator, Allah. Somebody say other name God, Ishwar, Bhagwan, Khuda, Maulid. As a Muslim, I say Allah. Allah is the one and only creator except Allah, all are creation. Last English prophet. Not fight for creator name, fight for understanding. You know that human animal also need fuel. Animal cell. Tree cell also need fuel. Take carbon dioxide, you know that, give oxygen. And virus bacteria needs host. But what about virus? T2 virus need host. Also virus bacteria plasmid have cell like T. No. Virus bacteria also creation. Atom have sense like human. Atom also. So in sun, moon, earth made up of atom. All are creation. Black hole have atom. Dark matter, dark energy, and hole. As per science, black hole also creation. Universe, dark matter, dark energy. 95% as per science dark energy equal more or less 4% dark matter. In universe, all are creation. And creator is one and only. And creator created universe, not only universe but also multiverse. Not only by universe, creator is one and only proof. As a Muslim, I say Allah. Allah is the one and only creator except Allah, all are creation. In universe, you know that multiverse, what happened going on multiverse? Then multiverse, universe,